Alzheimer's is a type of dementia that causes problems with memory. Symptoms usually develop slowly and worsen over time, but there's a way to evaluate warning symptoms if a loved one's behavior starts to change. Dr. Leah Leonard-Streckline is a psychologist and the director of Northern Nevada Medical Center's Bridges program. Welcome and thanks for being here.
Thank you so much for having me.
Yeah, so what are the symptoms?
I think one of the biggest warning signs that people start to see is forgetfulness, especially forgetting recently learned information. So they forget names and dates, and they repeat themselves or ask the same information over and over again. Or they have difficulty completing a familiar task, a recipe they've made for years, and they really start to socially withdraw, and they don't engage with family or with friends.
Wow, and so Senior Bridges offers free assessments. What do you look for when you see someone?
Really what we're looking for is an overall assessment of health, and we will refer people to their primary care physician to check for other conditions that might be impacting how the brain is working. When people come to Senior Bridges, we tend to really see the behavioral disturbances associated with dementia, so some of the depression and the anxiety, even paranoia and aggression.
Yeah, because people aren't used to feeling that way, right?
Absolutely.
Now, there's no cure, but how do we keep the disease at bay?
Really, our best treatment is the treatment of the symptoms. We can treat the cognitive symptoms with some medications, and that really just stabilizes the symptoms for a limited period of time. We can also treat the behavioral symptoms, which is a lot of what we do at Senior Bridges as well. We can use music therapy and pet therapy and aromatherapy to help people with the depression and the anxiety and the agitation.
Okay, and is it hereditary?
It can be. One of the big risk factors is family history, but the biggest risk factor is actually age. The majority of people with Alzheimer's are 65 years of age or older.
Okay, and how about a link between type 2 diabetes and Alzheimer's?
Anything that impacts your heart health and your blood vessel health can impact and be a risk factor for dementia. So heart health is your health.
All right, thanks for joining us, and you'll be
Thank you.
here taking calls, so give
Absolutely.
us a call, and thanks for joining us.
Thank you so much.